Hello expecting parents and very good afternoon. I am thrilled to be here today with you all. I am Dr. Pragya Goel, Senior Consultant, Obstetrician and Gynaecologist at Cloud9 Hospital, Chandigarh. Today, I will be discussing about early pregnancy complications. Feel free to drop your questions in the comments if you have. Now starting with early pregnancy. What is early pregnancy? It is the initial stage of pregnancy, typically spanning the first trimester, that is, first 3 months or till 13 weeks of gestation. This period is marked by various physiological changes and hormonal fluctuations. This time or the early pregnancy is a wonderful time filled with lots of excitement and anticipation. However, it is very important to be aware of certain complications that can arise, as early detection and timely treatment are important for ensuring the health of both mother and the baby. Here are some of the common early pregnancy complications. Starting with bleeding. We expect no bleeding in pregnancy, but there are several factors that can lead to bleeding in early pregnancy, ranging from normal physiological process to more serious complications. In the normal physiological process comes the implantation bleeding. It occurs when the fertilized egg implants in the lining of the uterus and causing disruption of the minor blood vessels, which further leads to little spotting. And it occurs around the time of the expected periods. Bleeding or spotting can also occur because of cervical irritation caused by sexual intercourse, pelvic examination, or by doing certain physical activities that can irritate the cervix. Heavy bleeding can occur in miscarriages. Miscarriage is the spontaneous loss of pregnancy before 20 weeks of gestation. Incidence is 10 to 20% of the known pregnancies. Causes are chromosomal defects or abnormalities in 50% of cases, maternal medical conditions like diabetes, uncontrolled sugar levels, hypertension, thyroid disorders, environmental factors such as infections, alcohol intake, smoking, being overweight or obesity, and advanced maternal age are there. In first 3 months, 1 in 5 women can have a miscarriage without any apparent cause. Symptoms of miscarriages are vaginal bleeding, abdominal cramps, low backache, and passing of tissue. Prevention of miscarriages is by maintaining a healthy lifestyle, optimizing or well controlling the pre-existing medical conditions, early prenatal care, and avoiding certain substances and medications in the first trimester. Now discussing about ectopic pregnancy. It occurs in 2% of pregnancies. Ectopic pregnancy is a pregnancy that occurs outside of the uterus, mainly in one of the fallopian tubes. The fertilized egg in ectopic pregnancy cannot develop into a viable baby. It is considered a medical emergency and it needs immediate treatment, as it can lead to life-threatening complications if not treated on time. Symptoms are missed periods, abdominal pain, or bleeding or spotting. Diagnosis is by ultrasound and by blood tests called beta-HCG levels. Treatment options include the medical treatment or the surgical treatment depending upon the severity of the situation. Next is molar pregnancy. It is a rare form of pregnancy in which the fertilized egg cannot develop normally. Instead of forming a healthy placenta and fetus, the placenta develops into a group of grape-like cysts. Hence, any bleeding during early pregnancy should be evaluated by your doctor to know the cause so that appropriate treatment can be given on time. Nausea and vomiting in pregnancy. Nausea and vomiting in pregnancy is a common symptom. It is also known as morning sickness. Severe form of morning sickness characterized by persistent and uncontrolled nausea and vomiting is called hyperemesis gravidarum. Hyperemesis gravidarum can significantly affect the life of pregnant women by causing dehydration, electrolyte imbalance. Significant weight loss can be seen in these women. More than 5% weight loss from the pre-pregnancy time is there, and it can also cause psychological distress. Causes are basically combination of factors like hormonal changes, genetic predisposition, stress and anxiety, and multiple pregnancies. The good news is hyperemesis gravidarum improves as the pregnancy progresses, usually by the second trimester. Dietary modifications to prevent nausea are having small and frequent meals and avoiding meals that cause or trigger the nausea. Hydration is also very important. Infections in early pregnancy. Early pregnancy is a vulnerable period in which infections can cause significant risk to mother and the developing baby. Varicella, chickenpox, and rubella, German measles, are the infections that can cause birth defects. Other infections can be UTI, called urinary tract infection, toxoplasmosis, then influenza, cytomegalovirus, etc. Prevention is very important by getting vaccinated against rubella and varicella in the pre-pregnancy time itself, as there is no treatment for these infections in pregnancy. Try to practice good hygiene measures. Food safety precautions should be taken, and try to avoid contact with infected individuals. Medical disorders like diabetes, hypertension, thyroid disorders, they need special attention in pregnancy. Early prenatal care is very important to avoid the further complications. Also, lifestyle modification has a key role to avoid the further risks in the pregnancy, like stay physically active, avoid processed and packed food, avoid sugary and fatty food, try to maintain your weight in pregnancy, no extra weight gain should be there, and eating a well-balanced diet. Stress in early pregnancy. Early pregnancy, while exciting, can be stressful due to hormonal changes and the physical changes. Stress in pregnancy can negatively impact the pregnant woman as well as the growing fetus by causing miscarriages and further complications. But stress management techniques, they are very helpful in managing, like try to prioritize your sleep, aim to sleep 7 to 9 hours every night. Regular exercise is very important. Relaxation techniques like meditation and yoga are helpful. Eat a well-balanced diet. Deep breathing exercises are also very helpful. Discuss your worries or feelings with the person whom you want to share your feelings, or try to have a support groups who can help you during this phase. Additionally, open discussion with your doctor is very, very important for the positive outcome. Remember, early detection and timely management improves outcomes. Open discussion with your doctor has a vital role. Early pregnancy is just the start of your incredible journey. Embrace the challenges and joys with confidence and optimism. Please don't hesitate to reach out if you have any questions or queries. I'm always there to help you in your 9 months of journey. Thank you again for your time and attention. Until next time, stay healthy and empowered. Namaste.